Welcome to our project. My name is Bailey Wall, and I will be telling you about my group's research project. Our topic covers patient satisfaction with discharge information. This poster covers the purpose of discharge teaching, what should be included in a discharge summary, the role the nurse plays in discharge education, as well as the implications it has on both the patient's health and the hospital's readmission rates. We will also look at two regional hospital statistics regarding the relationship between readmission rates and patient satisfaction with their discharge education and planning. Discharge planning plays a vital role in patient care beginning with admission. As healthcare professionals, it is our duty to work together to get each patient back to or as close to baseline before sending them home. Readmission rates are often correlated with a lack of discharge understanding and education, which adversely affects the hospital because insurance companies will not pay the hospital for the readmission. We researched two regional hospitals around our area and found a direct relationship between patients who strongly agree they understood their discharge instructions and patient readmission rates. If a patient better understands his or her care when going home, the outcome of their health will likely improve, and vice versa. If discharge information is not understood or presented in an inappropriate manner, it often leads to the patient being readmitted. There are many purposes of discharge education. It allows patients and caregivers to understand their diagnosis and plan of treatment. For example, a newly diagnosed type 2 diabetic patient will be discharged with information regarding lifestyle changes, such as diet, exercise, and often a prescription for metformin or other sugar-controlling drugs. Proper discharge planning and education allows all members of the healthcare team to collaborate and ensure the patient is able to depart from the hospital safely and/or recover in an appropriate setting. Thorough discharge education decreases readmission rates and encourages the patient, caregivers, and family members to play an active role in the patient's health. The nurse plays a vital role when giving a patient discharge education instructions. It is critical that the nurse thoroughly understands the patient's plan of care before trying to teach the patient. Things to consider before discharge education include the patient's readiness to learn, any cognitive or physical limitations, as well as language barriers. The nurse's role also includes ensuring the patient is capable of preventing further injury to his or herself and providing additional resources if needed. Things that need to be included in discharge education are the reason for admission, significant findings such as diagnostics and labs, procedures and treatment provided, take-home instructions, obtaining signatures, and most importantly, answering and addressing any patient or caregiver questions and concerns. To ensure satisfaction with discharge education, there are some methods the nurse can choose from when teaching. The most common, and arguably the most important, is the teach-back method. This is when the patient shows the nurse or healthcare provider that he or she can properly complete a task, such as checking blood sugar. Written information is beneficial, as the patient can take it home and refer to it as often as needed. And in following up with primary healthcare provider, this written information is very helpful as well. Visual aids such as videos can be used to enhance education or even substitute verbal education if hearing is impaired. Knowing which learning style is best for patients plays a key role in their understanding and satisfaction with their discharge teaching. Circling back, all of this information on this poster is pertinent to discharge education experience. It is important that all of these factors be considered and executed properly to ensure patient satisfaction with discharge teaching, and in return, decrease readmission rates. Thank you for listening, and we would love to answer any questions you might have.